dementia have very close connections, but I can bring you first some good news. Stroke, we have a definition, we know what it is, we know what we're speaking about, and another good news is that we can prevent stroke and we can also treat stroke, but it doesn't mean that we have reached the final end. There are much more that we need to treat in the stroke field, and there are therapies and treatments that may come from things we do not immediately recognize. So I will start from the very basics with the early mobilization of stroke patients. These are my disclosures, and the starting point is one of the core issues really in stroke therapy, and this is organized inpatient stroke during care from stroke. This is one of the glories of evidence-based medicine, really one of the best examples how systematic reviews came into clinical practice and really have changed the entire stroke field in the way that is very profound and very dramatic. This is from the Stroke Unit Trialist collaboration and from the Cochrane review, and what you see is that if you organize your stroke care well, you have profound effects on the prognosis of the stroke, not only on survival, but also on dependency and institutional care of the stroke, with effects that are very profound. And if you look on this, on the population level of stroke patients, what you see here is that what we have available in the acute phase of therapies, we can use aspirin and start with that early. We can use thrombolytic therapy, as you know, which is extremely effective in the individual patient, and we can have the stroke unit principle, which is applicable to the entire cohort of stroke patients. Which of these therapies has the most profound effect overall, the most significant impact is stroke unit therapy. So this is the very basics. Wherever you are in the world, stroke unit therapy is the basis for stroke therapy. So what are the common features of stroke units? Is working together, is to have a protocol for assessment and monitoring, to do routine testing, to follow the patients, to have skilled nursing, to test for swallowing, if the patient can swallow or not, which is extremely important, to avoid secondary complications of the stroke, and to monitor therapy, and for early management, to follow a protocol with fluid, with nutrition, avoidance of fever, hypoxia, hypoglycemia, and the concept of early mobilization, the topic of my talk, and I will expand on, and then nursing care to position and handle the patient, effective swallowing, effective eliminations. So what you do not see much on this list here is drugs. This is not an effect of drugs, it's an effect of the management, the care, the nursing, the early mobilization, which makes these effects. And then we